Right after me, I'm going to kick it over to my main man, Mr. Arthur Benson. He is the Chief Executive Officer of Frisco Behavioral Health Group. I emailed y'all about him earlier this week, so if y'all trying to get y'all, I hope y'all brought them resumes and them cover letters, because this is the man that you want to holler at. So he is coming up to the stage right now. Thank you.
It is truly an honor to be here this morning, and I had the opportunity to meet Jasmine Johnson maybe about 3 weeks ago at a Kinko. Well, I'm telling my age now. It's Federal Express or FedEx now. But anyway, I noticed some things she had on her table there she was working on, and it impressed me, or it interested me, because it had to do with behavioral health. So I got to talking with her, and she was telling me about the organization that she was founding and starting, and I said, I want to be there. I am CEO and founding partner of Frisco Behavioral Health Group. We're probably the largest outpatient behavioral health treatment center in North Texas. I have 5 psychiatrists, 2 psychologists, 3 LPCs. We do transcranial magnetic stimulation for depressions. We have 3 ladies up front that just work themselves nonstop, checking in new patients every 10 minutes. We do about 100 or so patients a day in our outpatient clinic. We're quite busy. One of the things I wanted to let her know is I need some more help. So I'm here this morning to say, I believe there's one of my cards in each one of you satchel that you got. If you're interested, that's my personal phone number, that's my personal cell number on that card. I don't have anybody that wants to talk to me try to go through layers of secretaries or administrative people. If you want to see me, you call me direct and I'll answer the phone. If I don't, I will call you back, usually within 10 or 15 minutes. So I'm throwing out there today an opportunity probably for at least 2 more licensed counselors, behavioral health treatment centers, ladies, to join our staff. You make good money, very good money. I'm impressed with what some of our people do. But that doesn't matter, because what we're doing is saving lives and changing lives. We're reuniting families, putting children back with mothers and fathers, and we're doing things that are important. And I want y'all to be part of that with us. And I want to be part of your group, because I told Ms. Johnson what she is doing, that she may have started something giant right here this morning. And ladies, I'm impressed when I look across the room. I was telling her just a few minutes ago that in the United Kingdom, the world is celebrating 1 queen. I'm standing here before 100 queens this morning. Ladies, I should be applauding you, not you applauding me. Thank you for that. But one of the things I want to offer, besides these opportunities for at least 2 more right now, is to help y'all. My real quest is indigent treatment. And I know probably a lot of y'all may work in that area. Those that need your help the most can afford it the least. I want to open a new clinic in the west part of Dallas, which is a very blighted area of this city, to provide treatment to those. If they have a resource to pay, we'll take their funds. If they don't, we'll treat their services. We'll treat their needs. We will help them have a better life, because the road is short for most of these people, and the end is bumpy. I hate seeing that. I had 4 indigent treatment centers in Oklahoma that we had a 9-month waiting list to get into those treatment centers. We would actually call and say, Miss Smith or Mr. Jones, we have a bed for you today. Would you please have him or her report to our clinic on Sunday at 2 o'clock to check in? Mr. Benson, that person died last week from drug overdose. It's horrible. I sat on a drug court in western Oklahoma for 7 counties, making the decision who goes to treatment, who goes to jail. It hurts my heart to send anybody to jail or to say, this guy's been in treatment 7 times already. He's just wasting our time. I don't want that to happen. Not one failure, not one. So I applaud you, each one of you, for what you do to help families, to help individuals, to help children. We also have a child and adolescent psychiatrist that we work with people as children as young as 5 years old. So thank you. But the other company that I have is called Trinity Practice Management Solutions. We do every bit of the work, what we call the back of the house work, for individual practitioners or if you are part of an organization. You were trained and educated to provide life-saving and life-changing services, not to spend 4, 5, 6 hours a day filling out paperwork. I want to do that for you. I want to help each and every one of you or each and every company that you represent to improve and give you more opportunity to help people rather than sit back there, scratch your head saying, this is ridiculous. And it is. But it's necessary. And we're the necessary side. Because of your organization and what Ms. Johnson has put together here, I will make this available to y'all at a group rate for your whole organization. So if I can help you, that same card you can call me on in there. It's a separate company that I have, but I set it up to help clinics because practitioners didn't go to school, they didn't go to training to be administrators. You went through years of training to help people. I will be around for just a little while. If anybody would like to talk to me, you can either see me right after this, or if I'm gone, call me on my card. I will, if you're not from New Jersey, I'll come see you. But welcome to Texas. I always have to share this, and then I'll get out of the way. I was born 2 blocks inside of the Texas border. I'm from Texarkana originally. I was born at the Texarkana Hospital, which you can see the state line if you look out the window, if that building was still there. That's how close I am to Arkansas. But even so, I get all the benefits of just like if I was born in Austin or Waco. But the room I was born in, that building later, after that hospital closed, was bought by the First Baptist Church of Texarkana. The operating room that I was born in later became a chapel. As a youth, I was baptized in that same room I was born in. Later in life, I was married in the same room I was born in and baptized in. So I guess it's about as Texas as you can get, probably. Now, unfortunately, that building has been torn down now, and it no longer exists. Or we could have my send-off in the same room, and it could be like Little House on the Prairie. Everything happened in one room for the whole 10 years of that television show. But I take pride in that anyway, and I take pride in the fact that I have the opportunity to stand before you here this morning. Congratulate Ms. Johnson. She is a true advocate for each and every one of you. You go out there starting Monday and just do everything you can to help people. I know sometimes you walk away saying, this is hard. Nothing good is easy. And I am so happy to be part of you and be before you here this morning saying, I want to help you today. And 10 years from now, when this room is in a place that you have to have 10,000 people that are a member of your organization, I want to be there then, if God still allows me to be on this earth. Thank you, ladies, and I applaud you and thank you for this opportunity today.